was in 2010. I was a young doctor, assistant professor in Beaujon Hospital in Paris, in France, and Dr. Richard Moreau, who was the PI of the CANONIC study, proposed me to participate into the study, into the inclusion of the patients. So, of course, I said yes immediately. When I started to work in the CANONIC project, I have never heard about ACLF, so I learned a lot about ACLF, and I gained some expertise that I could apply directly to patients' care. So I think that it was the best lesson I learned. The most exciting moment was when I read the manuscript and I saw the results in 1,200 patients, and I could see that they completely reflected my clinical impression. It impacted a lot on my career. First, I think that it had a big role in my decision for an academic career because I had a lot of fun in this clinical research experience, and then I had the chance to work with Richard Moreau, who then involved me into other projects, especially the North-Flow study and now the CHANGE study. Well, now we are more and more involved in the quality of life of the patients, and this is very important. At the beginning, the primary and the most important endpoint was the survival, and now management of the patient has improved and many patients survive, and another important point is the quality of life. I think that the paradigm has already happened. When I started hepatology, patients with ACLF almost never went to intensive care units, and we had to call the intensivists and convince them that these patients could survive. And now we receive phone calls from intensivists, and they ask us whether we should consider liver transplantation in these patients. Well, first, it's a great recognition for our work in our center, our work in the liver transplant field, and of course, it's a great honor and an opportunity to participate into very important studies, especially the CHANGE study.